course, we need to have conducive environment for schools. And of course, one of them that is addressed in law is the no licensing of liquor outlet within 300 meters radius of a basic learning institution. So we are also imploring upon county governments to ensure that this one is actually adhered to. Because when there are liquor outlets around, you know, the kind of picture you're giving to young people is that thing is accessible. But again, through the guidelines I've just shared, it is also important to let the school administration be aware and vet, even especially those people who sell snacks within the vicinity of schools, because those are sometimes used as peddlers. So we are telling them to be very, very keen and observe who is it that is selling these snacks to our children. Yeah, so those are the information that we've given out to the schools. And we are also telling parents to be vigilant, because again, when children are on holiday, when children are at home, some of them also fall into alcohol and drug abuse, and it boils down to positive parenting. We need parents who are responsive. They communicate, listen to their children. We need parents who are also really providing structure. You know, young people as they grow, I mean, with the influence of social media and all these other things, they need direction. And of course, at the home setup, you also need to set up an example. Somebody who doesn't drink, but again, provide, you know, limits in terms of the time when they come home. You monitor who are their friends, which parties do they go to, which activities do they go to, are there adults who are going to, you know, be there, present, and also telling them about their dangers. Be involved by communicating, monitoring them, you know, spending time with them. Okay.
So just introduce yourself.
Okay. Good afternoon. My name is Robert Olwech. I work for NACADA as the county coordinator for Nakuru County. And today is an exciting day because it is an international day against drugs and illicit trafficking. That is IDADA. With a theme, World Drug Problem, Persisting Issues, New Challenges and Innovative Responses. So this is an event that we observe and commemorate each and every year on June 26th. And as NACADA, we are commemorating it at the national level in Mombasa. But also in all the 47 counties, we are also holding this event. So for us, we are excited that today we've been able to meet here at Nyayo Gardens in Nakuru with many stakeholders, with our chief guest as the county commissioner, who's come with the security committee together with the assistant chiefs. We also have county government represented, Alcoholics, Drinks and Control Department. We also have the county public health officer. We have various government organizations, probation office. We have National Syndemic and Disease Control Council. We have people drawn from community groups. That is community-based organization. We also have Interreligious Council representing the religious leaders, and also treatment and rehabilitation facilities that are drawn from within this county. So, and we also have members of public. We also have people from Boda, the youth and young. So this day we are using it as an opportunity to continue to educate the public on the dangers of alcohol and drug abuse, and actually also share on what are some of the challenges that they are facing within the community setup, because we know even from our researches that 4.7 million Kenyans are actually using at least one drug, and of course the major one is alcohol at 11.8% in terms of prevalence. And of course here in Nakuru County, together the multi-agency, we have been cracking down on illicit brews, but of course the young people are telling us that there are also emerging drugs that are coming in, like one that has been cited as SGR, a kind of liquor that is concocted with ethanol and this other water. And of course, when people take it, they black out. I mean, the effect is so strong. I mean, with 20, 50 bob, somebody can actually be knocked out by this drug. So we are trying to work with intelligence to crack down on the same. Even Bangi, which they are complaining is also affecting the young people. We are also working with various agencies to be able to crack down on the same, and also use the community structures, because Nyumba Kumi are also here. And, sharing the intelligence information regarding these drugs helps a lot in terms of enforcement. But we know that much as we do supply suppression, we also need to do public education and awareness to tell young people about the dangers of these drugs. So we are doing this through the various community structures, barazas, and of course even for schools, both primary and high school, and universities. We invited universities here, Egerton University, KMTC, and Arvist, all these other institutions. We usually go and conduct sensitization, because we know that universities and colleges is also another frontier where young people are taking drugs. So it is a menace that we need to combat in all aspects, right from prevention. And those who are affected, we have treatment and rehabilitation owners who are here highlighting the services that are offered in those places. And of course, NACADA as the regulator, we usually accredit some of these facilities so that those who are affected can actually go and get help. So we realize that another key emerging thing is the fact that there are also new psychoactive substances like drugs, amitriptyline, tramadol, mefamantine, which is actually also affecting people. And it is something that through the recently launched water analysis that we did a few weeks ago, has actually revealed that there are many drugs that are being taken by the people. And Nakuru, of course, was also one of the cities and towns that the samples were taken from. So as NACADA, we are coming up with innovative ways in which we can be able to address some of these challenges of drugs beyond public education and enforcement, also using data and research to inform us what are some of the new trends. And we are also telling parents to be vigilant, because again, when children are on holiday, when children are at home, some of them also fall into alcohol and drug abuse, and it boils down to positive parenting. We need parents who are responsive. They communicate, listen to their children. We need parents who are also really providing structure. Young people, as they grow, I mean, with the influence of social media and all these other things, they need direction. And of course, at the home setup, you also need to set up an example. Somebody who doesn't drink, but again, provide, limits in terms of the time when they come home. You monitor who are their friends, which parties do they go to, which activities do they go to, are there adults who are going to, be there, are present, and also telling them about their dangers. Be involved by communicating, monitoring them, spending time with them. Be involved because some of them are now taking things like vape. Vape is becoming very popular amongst young people because they think their perception in terms of harm is low of these things, because they think it's harmless, but it still has nicotine, which is actually an active ingredient of tobacco that leads to addiction, dependence on some of these things, shisha and the like. And we know that some of them are getting laced with hard drugs, heroin, cocaine, so they have negative impact. So we need to tell young people to be alert. Because even through social media, they can really be told where parties are. Some of them can access, alcohol. And that's why in the national policy against alcohol and drugs, some of the propositions were on things like ban on online sale of some of liquor and drugs, and even in other places like parks, stadiums, like supermarkets and all that, where young people, because they are not followed up, can really access these drugs. So it is a concerted effort. We need to have a multi-agency approach where each and every agency is involved and works to ensure that we control drugs in the country, because clearly it's a menace. We see the challenges that are happening, even so to speak. Some people have actually told us even the banning of schools, which is quite unfortunate. You find that maybe some of the students had already started engaging in drugs. So we tell people to at least be careful and to be vigilant. And as NACADA, we are offering our support to partners and inviting everyone to collaborate, because this is not a one agency effort. It requires all of us to be able to protect our people so that they can become productive, they can become safe, healthy, and contributing members of the society. Because when we have a society where people are drinking, where there's a lot of addiction, then we know that we are raising a generation that is going to cause problems. So instead of curtailing their future through the drugs, we want to encourage them to get into, the academics, to get into sports. Right now, as a government, you're promoting digital economy and, creativity. We want them to be creative in ways that they can even earn income, but in which they can get busy. So that they don't have time to think about alcohol and drugs, which has caused also a lot of mental health illness, even in the family. That's a very good question. Of course, in our study in 2022, it revealed that initiation into tobacco, for example, was 6 years. For alcohol was 7. For cat was, I think, 8, and cannabis 9. So these are quite young ages, which is quite alarming. And of course, we did research for primary school, which shows 2.6 primary students are taking alcohol and 3.8 taking alcohol in secondary school. So you see that the age of initiation has really gone down. And that informed us, working with the Ministry of Education and TSC, to be able to develop what we call national guidelines on alcohol and drug abuse management in basic learning institutions that actually give guidance on issues of, awareness creation on issues of alcohol and drugs, counseling and referral, how to manage incidences within the institution, incident management, and also how to collaborate with the different, stakeholders to monitor these issues. That is the boards of management, very, very critical, teachers, Ministry of Interior, and also us as NACADA to give input. So those are some of the things that we've developed, and we usually conduct a lot of sensitizations in schools. In high schools, we also conduct a lot of sensitization, and we also have life skills training where we've trained teachers and they are able to discharge the same to the students, where we are able to build their social skills, decision-making skills, how to resist drugs and peer pressure, and also how to be aware of the negative advertisement, because through adverts they sort of think that this thing is glamorous, is good for me, but it's actually not. So we are able to knock off all those myths, and of course we've also developed materials that are age appropriate, from 2 to 4 years, 6 to 9, 12 to 13, and then of course 15 to 16. That actually give guidance to the students. And we also have guidance for teachers. We also have booklets for teachers that they can be able to read and actually share the same information. Of course, we need to have conducive environment for schools. And of course, one of them that is addressed in law is the no licensing of liquor outlet within 300 meters radius of a basic learning institution. So we are also imploring upon county governments to ensure that this one is actually adhered to. Because when there are liquor outlets around, the kind of picture you're giving to young people is that thing is accessible. But again, through the guidelines I've just shared, it is also important to let the school administration be aware and vet, even especially those people who sell snacks within the vicinity of schools, because those are sometimes used as peddlers. So we are telling them to be very, very keen and observe who is it that is selling these snacks to our children. Yeah, so those are the information that we've given out to the schools. Yeah. Thank you. That is a very important question. Like I said, as a government, we have one government approach, which we say is multi-agency, that is shared by the county commissioner, together with the security team, and of course NACADA as the secretariat, but we also have other agencies like KRA, KEBS, county government, public health department, and alcoholics liquor department, NIS, and all that. So we work very closely together. We meet to be able to see strategies in which we can combat drug and alcohol control within our vicinities. Of course, one of the challenges that has been raised, and if you listened to some of the sentiments from the public, is the fact that sometimes when people are arrested, they are released. I think that is something that as a multi-agency we've raised concern with the ODPP and the magistrate, but the challenge again lies in the law, that the penalties that are stipulated are still low. And therefore, when we met during last year's Jukwaa la Usalama, one of the recommendations is to have stiffer penalties for people who are found to have committed an offense. Again, on a matter of sometimes the chief being asked or police to prove whether this is liquor or banky, because actually that is how the law is, and the fact that the government chemists are also few. I think there is a proposal to have the decentralization of government chemists, so that evidence can be compiled very fast. If a sample has been taken, it can be tested, and the result come quickly, so that prosecution can proceed, because that one has been actually a hindrance in terms of prosecution of people, because actually the law requires that you prove whether the sample you've collected is actually liquor or it is a drug before the case can proceed. So those are the challenges that are being handled at the national level. The multi-agency team is working to see where there is need for amendment of some of these laws, then that can be done. But again, in the interim, what we are doing is, like when crackdown is being done, we are also collaborating with the ODPP and the magistrate to ensure that at least they understand the magnitude and are able to take to sentences, especially those who are repeat offenders, who have become arrogant and pushing impunity.